Her mother knew Alisa was going to die, but it was how she spent her last days that remains the most painful memory. In the final stages of her cancer, the 3-year-old was screaming in pain as her mother and aunt scoured the city for morphine.
First, we went to the chief doctor at the local hospital. She sent us to the district oncologist. The district oncologist sent us to the chief city oncologist. He also said he couldn't help. We went to the children's hospice, but they didn't have the license to give us the painkillers.
Alisa died before she received the drugs. Russia's leading patient rights expert says the country's system of palliative care is underdeveloped.
In theory, there does not need to be the presence of a child oncologist or even a general oncologist for painkillers to be prescribed. So what we have to blame here is how the system works in practice.
Alisa's case is tragic and unusual, but there are wider problems with the system that affect the treatment outcomes for thousands of children. 4 out of 5 children who enter this ward will leave it completely cured. Advanced equipment has been installed, and the latest treatment protocols from around the world are used. Specialized government oncology programs have seen funding increase rapidly, but the doctors here admit there's a long way to go.
The issue isn't just treating the patient while he's in the hospital. It's not just about diagnosing the illness. It's about the standard of general pediatric care. Only when all parts of the system are working does the treatment become efficient.
Unlike in the best hospitals, experts estimate that across Russia, only half the children with cancer survive. Charities have sprung up to help where the official state medical care is insufficient. Maria is a volunteer for Advita, one of Russia's oldest charities.
In Russia, we use foreign treatment protocols, but often the Ministry of Health does not import all the medicines in them. This is where we step in, importing medicines with our funds. We're also involved in getting more people to give blood for cancer patients.
With financial constraints and a healthcare system that is still in transition, it will be decades before Russia catches up with the world's leaders in fighting child cancer. But at least more than ever before, the government, the medical community and ordinary people are aware of the scope and importance of the problem they're faced with. Igor Gorodnev, RT.